Indomethacin is a nonsteroidal anti-inflammatory drug NSAID that is commonly used for its anti-inflammatory, analgesic pain-relieving, and antipyretic fever-reducing properties. Here is a brief overview of its pharmacology. 1. Mechanism of action. Indomethacin works by inhibiting the activity of cyclooxygenase COX enzymes, specifically COX-1 and COX-2. These enzymes are involved in the synthesis of prostaglandins, which are substances that promote inflammation, pain, and fever. By inhibiting COX enzymes, indomethacin reduces the production of prostaglandins, leading to its anti-inflammatory and pain-relieving effects. 2. Anti-inflammatory. Indomethacin's primary pharmacological effect is the suppression of inflammation. It is used to treat conditions such as arthritis, gout, and other inflammatory disorders. 3. Analgesic. Indomethacin provides pain relief by reducing the production of prostaglandins, which sensitize nerve endings to pain signals. This helps alleviate pain associated with various conditions. Antipyretic. By inhibiting COX enzymes and prostaglandin production, indomethacin can lower fever and reduce body temperature in individuals with fever-inducing conditions. Pharmacokinetics. Indomethacin is typically administered orally in the form of capsules or tablets. It is well absorbed from the gastrointestinal tract and has a relatively short half-life. It undergoes hepatic metabolism and is primarily excreted through urine. Here are some general guidelines for dosages of indomethacin for common conditions. Rheumatoid arthritis and osteoarthritis. The typical starting dose for adults is 25 mg to 50 mg taken 2 to 3 times daily. The maximum recommended dose is usually 200 mg per day, divided into multiple doses. Acute gout. The initial dose may be higher, often 50 mg 3 times a day until pain and inflammation are under control. Afterward, the dose is typically reduced. Ankylosing spondylitis. The starting dose is usually 25 mg to 50 mg taken 2 to 3 times daily. The maximum dose is typically 200 mg per day. Pain and inflammation other than the conditions mentioned above. The dose can vary but often starts at 25 mg 2 or 3 times daily. Common side effects of indomethacin, a nonsteroidal anti-inflammatory drug NSAID, may include 1. Gastrointestinal issues, upset stomach, nausea, vomiting, diarrhea, abdominal pain. 2. Central nervous system effects, headache, dizziness, drowsiness. 3. Skin reactions, skin rash, itching. 4. Cardiovascular effects, high blood pressure, hypertension. 5. Fluid retention, edema, swelling, typically in the legs and ankles. 6. Gastrointestinal bleeding and ulcers. This is a less common but serious side effect. It may cause symptoms such as dark or tarry stools or vomiting blood. 7. Kidney function changes. It can affect kidney function, potentially leading to changes in urine output or color. Indomethacin, a nonsteroidal anti-inflammatory drug NSAID, can interact with various medications and substances. Some of its most common interactions include 1. Other NSAIDs. Concurrent use of multiple NSAIDs, including indomethacin, can increase the risk of gastrointestinal bleeding and other adverse effects. 2. Anticoagulants. Indomethacin may enhance the effects of anticoagulant medications, such as warfarin, increasing the risk of bleeding. 3. Aspirin. Combining indomethacin with aspirin can also increase the risk of gastrointestinal bleeding. 4. Blood pressure medications. Indomethacin may reduce the effectiveness of certain blood pressure medications, such as ACE inhibitors and diuretics. 5. Corticosteroids. Combining indomethacin with corticosteroids can increase the risk of gastrointestinal side effects. Indomethacin suppositories rectal. These are often used when a patient has difficulty swallowing pills or when a more immediate and localized effect is needed. They may be preferred for individuals with gastrointestinal issues, as they can bypass the stomach. They tend to work faster because they are absorbed directly into the bloodstream through the rectal wall. Indomethacin tablets, capsules oral. This is the more common form of indomethacin and is taken by mouth with water. It's absorbed through the digestive system, so it may take longer to provide relief compared to suppositories. It's suitable for conditions where a systemic effect is needed or when your healthcare provider determines it's the most appropriate option